Welcome back, Lindsay Friedman. She is the founder of LTCareNav. Welcome, Lindsay. How are you?
I'm good, thanks. How are you?
Good. Always good to see you. And we're joined by Denise Simmons, one of the partners at LTCareNav, and she is the founder of Wisdom Senior Care. Welcome, Denise. How are you?
Hi, thank you. I'm great.
Good to see you. Thanks for being here. So, real quickly, tell us, what is Wisdom Senior Care?
So, Wisdom Senior Care, we are a franchise brand nationally where we provide private duty home care services for seniors who want to age in place. So, it's the traditional services in terms of transportation, errands, companionship, end of life support, personal care, all the things that keep them aging actively at home.
Wonderful. Well, Denise, I wanted to talk to you about a few things here. And I want to talk first about the sandwich generation. Who is the sandwich generation, and why are so many families finding themselves in that role today?
Oh my gosh, the sandwich generation was me. So basically, the sandwich generation is an aging adult who finds themselves in the middle between having to raise their children, or they're still taking care of their adult children, at the same time, simultaneously caring for an aging parent where their health may be declining, or an aging family member. And sometimes, most of the times, they are also working full time. And so they're having to juggle simultaneously all those roles and responsibilities that have not only a physical, spiritual, financial, but an emotional toll on them as well.
Yeah, absolutely. And, many people think of home care as something you only arrange after a crisis. We experience that ourselves with the families we serve here in Michigan. How can bringing, in-home care earlier help to improve those outcomes for both not only the older adults, but also their family caregivers?
Oh my gosh, it brings a level of peace of mind and clarity, especially as we start to see those subtle signs as aging, as adult children. It's important for us to start having those tough conversations early, right? And what would mom or dad in a situation if the spouse was no longer able to take care of them? Where would they want to live? Would they still want to be in the home? Would they want to live with the adult children? Those conversations in preparation help to mitigate the frustration, the guilt, the stress that comes when the adult child has to make those decisions by themselves, or they probably don't even know the wishes of their parents. And so that adds on a level of, oh my gosh, I don't know, overwhelmed, what do I do? And then it just makes it for a very hectic situation. So yeah.
Yeah, no, absolutely. And, talking about these hectic situations, what are some of the biggest misconceptions that families have about home care, and how do you see that those misconceptions prevent them from getting the support that they need when they need it?
The biggest one is adult children feel as though they can do it all themselves because they've been managing it all themselves, right? They've been handling the medications, the doctor's appointments. They're juggling, but not realizing they've been, the balls have been dropping, and they're sacrificing their peace of mind, their well-being, and not realizing their health is declining. And so having a skilled professional team of people who are trained to work with loved ones, seniors who have dementia, and keeping them engaged, that adds a level of dignity to their lives. Or having someone to step in to do that meal prepping where you were handling it on your own. So that misconception of they can do it on their own, but no, have a trained professional to step in to give you respite, give you peace of mind, is the biggest thing.
Yeah, absolutely. And what's the first step that families should take if they have questions about home care, or really wanting to understand what home care is all about?
I really think with the age of our internet and AI, just start to have a conversation with AI, and really in that conversation, you'll start to discover some resources. You'll start to discover some things that maybe you haven't known. And when I say conversations, really have a conversation. Say, this is the situation that I'm in, right? Lindsay, you're big on technology, and feed it your background, your history, and then it'll start to tell you, or it'll even start to have you look into some areas that maybe you weren't thinking about, and start to have that conversation about what is home care, how can it support me, what are some things that I'm missing that home care can help me on.
Yeah, absolutely. And I know dementia is one of the biggest issues that, we help support families with right now. And with dementia diagnoses continuing to rise, why is it no longer enough for home care companies to simply just provide caregiving services? Why must they become true dementia care experts?
You know what? I've lived, I've been a caregiver for both my parents. My mom had vascular dementia. She passed away last year. And the things that I know now, oh my gosh, I wish I knew back then. But when it comes to dementia, it's not about the traditional coming to cook and clean, right? Families are really looking for support where they're seeing their caregivers doing things. Like, they want them to have because they're still seeing them as this person that was doing accounting, or they used to do their hair, they used to put on makeup, they used to take a bath, and now they're not seeing this anymore. And so it takes people like us who are trained in dementia care. I'm a certified dementia practitioner, to really come in and engage with that person based off of their behavior, right? Because people with dementia, they communicate with their behaviors. It's no longer reasoning. They're no longer able to put the right words to what they're feeling in that moment. So it's important to have someone who can be able to identify, okay, this is sundowning dementia, so there needs to be a routine. Okay, at 8 o'clock, we need to make sure that certain things are happening. So that's why it's so important.
Yeah, no, absolutely. And you've talked a lot about trained professionals and certifications. What specialized training or resources or approach should families be looking for when they're choosing a home care company for someone living with dementia?
Most importantly, from the leadership all the way to the caregivers, what in terms of the specific trainings that they're getting in dementia. So I'm a certified dementia practitioner. My caregivers are becoming knowledgeable in TIPA snow approach. And so understanding that there are different learnings and different styles and how to engage, and ensuring that the people who are providing care understand how to engage with that client is important. So those are some of the trainings that we do, and we do them on a regular basis. In certain states, they have like the traditional dementia and Alzheimer care that they have to view online, but are they going a further step beyond? We're about to do a dementia sensory training, where we really put our caregivers in the shoes of someone living with dementia, so their approach to care is more empathetic, and they can be able to really provide great care.
Have you done one of the real life sensory trainings?
No, it's something that we're about to embark on.
It's absolutely amazing. Reach out to me after the show, send us an email. We can connect you with the company. They're in Southern Ohio, I believe. Lindsay, you may be familiar with them, but they actually came to our studios, and we did a live in-person one and recorded it. And it really is such an amazing experience to really give you the appreciation for what somebody living with dementia is experiencing firsthand. They're incredible trainings.
I'm going to definitely talk to you then after this.
And for someone, going back to like the sandwich generation, for someone who's balancing work, children, and their aging parents, what's the practical advice you would offer them to help them avoid that burnout while also ensuring that their loved ones receiving the best possible care?
I always tell them that you cannot pour from an empty cup. And it is important for you to delegate and See what your circle is around you and start to tap into it. It could be a spouse, it could be a neighbor, it could be a friend. And even if that friend is, not physically there, but there are things that a long distance friend could do, whether it's setting up those doctor's appointments, making those calls, or doing the research, or finding things online that they can help you with. Like every person in your life, and you don't know it because you're just in silo and you're just on go mode, can have a role that they can play in being a part of your support team, your village, I should say.
Yeah, absolutely. Denise, how many years have you been in business?
So, as a home care agency owner, 4 years now.
Oh, congratulations. And you're in Florida?
Yes, we're specifically in the Broward County area.
Wonderful. And I know you're a partner at LTCareNav. How is LTCareNav help support you?
So Lindsay and her team has this phenomenal technology where it's specifically able to give and generate leads for our county, and which I love, because there are a lot of companies that will give you a lead, but then they give it to 10 other home care agency owners. And so we're excited about this partnership because we can truly be intentional, right, about our care and our time. I don't have time to sit there and like chase people and chase calls and be ignored. Like, I really truly want to help families that need our help and support. And so I'm excited about what Lindsay and her team is doing.
That's wonderful. And Lindsay, I want to go to you as we close here. When somebody's watching or listening to this, not only getting this, helpful resources and information, but maybe they're an agency owner like Denise, how can they look into becoming a partner with LT CareNav?
Yep, so if you go to the site, we actually have a tab that says for providers, and you can reach out. We have a vigorous interview process. We have referrals. We take recommendations. We want to make sure we're making really great matches for our family. We do one-on-one matches, as Denise said. So we match along a bunch of different criterias, but we want to meet you. We want to talk to you. We want to find out your why. Why are you really doing this? What is the motivation? Because we are here to really help families and to help the providers know that when we're making a match, it's a good, qualified family that's already in need.
Yeah, wonderful. And that's ltcarenav.com?
Yep.
Wonderful. And Denise, what's your website for viewers or listeners who might be in the Florida area?
Yes, go to wisdomseniorcarefortlauderdale.com.
Wonderful. Well, thank you both for being here. Denise, thank you for the work you're doing. Lindsay, always great to see you. And we encourage everybody to reach out to Denise and to Lindsay.
Thank you so much. Chat with you soon, Lindsay. Bye.